During the last 7 months, we have heard the Premier say that PSWs are the real heroes of this crisis, that they are champions. But, Speaker, these heroes need more than empty words. They need a living wage so they don't have to run from one low-paying job to the next. These heroes are overwhelmingly women and people of color who work incredibly long and hard hours to care for our loved ones. So, Speaker, I have one simple question. Will the Premier raise wages for PSWs so these frontline heroes are treated like the working heroes they really are?
To respond on behalf of the government, the Deputy Premier and Minister of Health.
Thank you, Speaker, and thank you very much for the question. This is a really important issue. Of course, we're very, very grateful for the work that's been done by all of our frontline workers, doctors, nurses, personal support workers, staff, volunteers, everyone. But you're right, personal support workers are in a particular situation. We are graduating thousands of personal support workers every year, but they're dropping out for various reasons, pay being one of them, but there's other reasons as well. So we are working steadily towards a solution for this, which I'll address more in my supplementary.
And the supplementary question.
Speaker, I believe the minister needs to understand the critical staffing shortages our long-term care facilities face. The recent LTC staffing study over the summer found that half of PSWs working in long-term care leave after 5 years, and I quote, due to burnout of working short-staffed. These frontline heroes are tired. They're overworked. They're underpaid. They did not stop being heroes on August 13th when pandemic pay ended. We could be on the brink of a second wave in our long-term care homes. The issue is dire and it's urgent. So, Speaker, will the government commit today to immediately addressing the staffing shortages in our long-term care homes and extending pandemic pay for all frontline healthcare heroes?
Minister of Health.
Thank you. Well, I certainly can agree with you that there is an urgent need for personal support workers in our long-term care homes, but also in home and community care. You're absolutely right that we need to make sure that we have the health, human resources necessary in order to fight a potential second wave of COVID-19. We have a fall preparedness plan that is virtually ready to go, and that is one of the important issues that it does address. The lack of personal support workers in particular, but there are also shortages of nurses as well. So we know that we need to do that in order to be able to successfully fight a second wave of COVID-19, and we are addressing that both with respect to the pay issue, but also with respect to scheduling of hours, the work locations, the ability to ladder to be able to help personal support workers to move from that level further into the healthcare system, perhaps to become registered practical nurses or registered nurses. They need to see a future in healthcare, and we are looking at all of those aspects with our Health Human Resources Plan, which we will be discussing with everyone in the legislature very shortly.
Thank you very much.